Well, hello, everyone, and welcome to tonight's EllieMD Educational Series. We're excited to have you join us as we continue our mission to help people live healthier, longer lives. At EllieMD, we go beyond healthcare. We provide education, community, and innovative healthcare solutions to support your journey to wellness. Tonight, we're thrilled to welcome back Dr. Josiah Wagner. Dr. Wagner is a leader in healthcare, specializing in regenerative medicine, peptide therapy, and hormone optimization. His journey began at 16 when a serious back injury left him facing the prospect of lifelong pain. Rather than accepting that fate, Dr. Wagner took control of his healing, diving into the world of peptides, stem cell, and biohacking. This transformative experience fueled his passion for helping others achieve optimal health and longevity. As the director of clinicals for RX Reinvented, Dr. Wagner trains clinics nationwide, empowering healthcare providers to use advanced treatments for weight loss, wellness, and anti-aging. He's committed to bridging the gap between traditional medicine and cutting-edge therapies, helping patients live healthier, longer lives. Dr. Wagner, welcome, welcome, welcome. We're so happy to have you back. How are you doing?
Good, how are you? That was quite an intro.
For our new audience members, can you please share a little about yourself and why you're so passionate about peptide therapy? I know I gave a brief background, but maybe you could elaborate a little bit more.
Yeah, so again, in the intro, really the catalyst for my life was that injury at the age of 16. It basically took me from, a very mobile 16-year-old to like 60 within an instant, and I was in chronic pain 24/7. It didn't matter what kind of position that I was in, whether I was walking, whether I was moving, whether I was not moving. I was in pain all the time. And the problem with that though too is even though I went to physical therapy, I went and got x-rays, MRIs, I went to every PT, every chiropractor, every medical doctor, I became like an enigma, meaning they didn't know what was wrong with me. And all I knew that I was in pain. And I could have either stayed in pain or tried to figure out a solution to fix that. So, and I don't really know like what inside of me drove me to do that because it felt like something almost like supernatural was pulling me in a direction to give me a belief that I could fix this. And that really, again, like I said, that catalyzed my journey. There was a lot of ups and downs, a lot of setbacks, a lot of frustrations in between, but eventually I was able to piece it all together and really regain my health back. And again, that just opened my eyes to a whole new world that really I didn't know exists. And my passion now is like sharing that knowledge with people, connecting people with that, connecting people with the divine intelligence that they have inside of them, and that we can really reverse engineer a lot of these conditions that people look as like death sentences, whether it's PCOS, hormone dysfunction, insulin dysregulation, metabolic dysfunction, all the normal signs of aging that we tend to accept really don't have to be the normal anymore. We can really define and change those things through, yes, diet and lifestyle, but some of the more powerful tools that we can use that I've come across are the peptide therapy. And obviously, I'll dive a little bit more deeper into that because I don't want them to sound like a panacea because just as great as they are, for each person, it's going to be a one piece of their puzzle. So it could get you 5, 10, 20% of the way there, but that doesn't mean that you need to stop. It's again, it's something needs to be your catalyst to get those things going. So yeah. I want to start to talk a little bit about the peptides too.
Yeah. No, and guys, be sure to stay until the towards the end of the call because we have a very special announcement as far as a product launch goes, and Dr. Wagner is going to do some training on it. So be sure to stay tuned. But we do want to cover some general peptide topics. So for individuals who are tuning in for the first time, they don't know what a peptide is, or maybe they've heard about it. Can you start at the very beginning of the basics? What is a peptide? What does it do? How does it work with the body's natural intelligence? Let's dive in.
Yeah, so couple distinctions here. One is, peptides are signaling molecules that your body naturally produces. So just as like we talk about them, GLPs, your body naturally produces GLP in the gastric system. When we use peptides, such as like the GLP peptides, we can make that signal stay longer and we can kind of help like reset that system to improve its efficiency. Same thing with like BPC and TB500. Again, those are naturally occurring compounds that your body produces, so your body knows exactly what to do with it. So it almost acts as like a regulator as opposed to forcing your body into something. So with the peptides, because it brings balance and cellular efficiency back to the body, I can give the same peptides to two totally different cases. Let's say one is has like a hyperactive immune system and one has like a hypoactive immune system. I can literally give them the same thing, and because that's just sending a signal to the cell to work more efficiently in this patient that's hypo and in this patient that's hyper, it's going to bring that balance and regulation. So, as opposed to like Western medicine, to where, if someone has high cholesterol, we're putting them on a statin. If they're high blood pressure, we're putting on a blood pressure medication. We're forcing the body to do something. We're trying to force it in a direction, and that's very unnatural. And what happens is you run into a lot of side effects due to that. You go from one medication to two medications to cover the side effects from that medication to cover, three more medications to cover the side effects for the one that's covering the side effects for the one before. And it's just this like nasty cycle. And with peptides, again, because we're helping with cellular efficiency, balance, and homeostasis, the side effect profile is almost like non-existent, which is like crazy to say and crazy to think that there's really little to no risk factors when it comes to using these peptide therapies.
Okay, so break it down a little bit more. Like we're back to biology class. Amino acids, why does your body naturally work with them? Because it recognizes it. Your body's made out of amino acids and proteins.
Yep.
So these peptides are just little beads of amino acids linked together, and that's what a peptide is. And you bring enough of these beads together, that's what you make. That's how you make a protein, correct? So your body recognizes them as natural in a sense, correct?
Exactly. Yeah. Again, it's these smaller chains of amino acids are considered peptides. Larger chains of amino acids are considered proteins. And all of those structures are built off of naturally occurring chemicals that your body already has. So when it's in the smaller chains, it's more like signaling molecules. It's saying, like, hey, let's do this, or let's do this, or let's do that, or let's do that. It's not forcing something as opposed to a medication where if you take like an ACE inhibitor, you're blocking something right away, or you give like hormone therapy, you're forcing something to happen. These are, again, naturally things where we're just tuning up the system to what it used to do. Because, for example, like certain amounts, let's say you have so many milligrams in your plasma of this peptide, as we age, we start to lose that cellular efficiency. So we're just kind of like reminding it what it used to be able to do.
Mhm. I have Rhonda said, so it's safe to say peptides are helping the body work as if it should, and medications are masking.
100%. 100%. Yeah. Yeah.
You were at the leader retreat now 2 weeks ago, and you did a phenomenal job training the leaders in our organization. And you broke it down into like the very basics of peptides and what we should use. Because I think a lot of people are confused as to, oh my God, there's so many options, there's so many peptides. Where should
Mhm.
I start? And I think GLP-1s are a great place to start if you're trying to lose weight. So maybe you could build up a little bit before we delve into the product launch that we have coming. Maybe you could just talk very general peptides. Which ones are the really good ones that people should subscribe to and begin if they're new to this journey?
Mhm. So we can kind of break the peptides into different categories. So the first one being the GLPs. Those are going to be fall in your category of metabolism. So we're resetting metabolism within the body, because metabolism, it kind of starts this domino effect throughout the entire body. If your metabolism is dysfunction, you're going to have dysregulations in insulin. These insulin levels are going to lead to chronic inflammation. Chronic inflammation leads to tissue destruction. Tissue destruction leads to immune system dysregulation, which leads to downregulation of your energy system. So this is where you always feel like you're behind. So it's all these things do not exist in a vacuum. You don't just have one condition or one diagnosis. So that's where the GLPs, because so many people are suffering from metabolic dysfunction, that the GLPs are definitely kind of like at the base of that pyramid or structure of what we're trying to do. The next one that I like to use in combination with the GLPs is going to be something called a growth hormone secretagogue, such as like a semarelin. So, growth hormone is one of the most important hormones that your body releases to help repair. And I had a chart at the leaders retreat to show all the different pathways that it activates. So, one pathway, it's antifibrotic, anti-inflammatory, helps with vasodilation. So it's going to open up those blood vessels, increase blood flow, as well as like all these other systems, cellular function, immune function. So there's so many different systems that that's hitting. And again, as we age, growth hormone decreases. And the way that growth hormone works, it works on what's called as a pulsatile system. So you get anywhere from 3 to 8 pulses throughout the day. Typically, your largest pulse at night between, let's say, between like 10 and 11. And that's if your sleep is optimal. And I don't know many people whose sleep is optimal nowadays because we live in these very artificial environments. You know, we eat late, we're surrounded by artificial light, so our body's natural rhythms are not in tune. So most people aren't even getting that release of growth hormone at night, which again runs into these other issues, is because at night, if when you get that growth hormone, your body goes into what's called a stage 4 sleep. Stage 4 sleep is very important for repair, but it also activates your glymphatic system. Glymphatic system is with the brain and it clears out all the plaque within the brain. So these things, again, you start to build up plaque over time. So that's where if we can add in these growth hormone secretagogues, we're increasing the levels of stage 4 sleep. The body's clearing out that plaque within the brain. But then also too, with the GLPs, because we are in a calorie deficit state, you know, the biggest thing I always hear is, you know, is the GLP is going to cause me to lose muscle? I hear people lose bone mineral density when they're on the GLPs. Like there's all these questions and misconceptions of people not knowing how to stack these things properly. So if we stack the GLP with a growth hormone secretagogue, such as like semarelin, we maintain a robust metabolism and we spare a lot of your lean muscle mass. So we leave you in a better state in terms of your overall metabolism, and we don't have to increase the dose so high on the GLPs. Because again, this is what other people run into, is that you're on your weight loss journey. Let's say you have to lose 10, 20, 30, 40, 50, 60, 70, 100 pounds. People get to the highest dose of that, and then they get resistance. It's not resistance. Your body's just adapting. Your body wasn't going to adapt. You would die. So if you're going into these calorie deficit states, especially once you start to teeter below like 1,000 calories, your body starts to hang on to that weight more because it's trying to keep you alive. So if we can add in that semarelin, keep that muscle mass, help your body to keep a robust metabolism, we don't have to increase that dose as high, and then we don't run into those issues. And then I mean, semarelin too, because you're holding on to that muscle mass, it helps with the osteoporosis issue. So you are helping to increase that bone mineral density. So that's definitely like the first one that I 100% pair with that. And then people are also like, well, what about tumor growth or cancer growth because of growth hormone? Well, if that was the case, kids would have tumors all over their body because they have high amounts of growth hormone. Again, the way these things work is with your natural system. So all it is helping your body's own natural production of growth hormone. And the body wants to be healthy. The body doesn't want to be in a dysregulated or dysfunctional state. That's why peptides bring back that natural balance of the body. So again, it's actually anti a lot of these XYZ diseases because it's bringing that balance back. So you don't have to worry about a lot of these conditions that you think are going to happen because the body's not stupid.
Wait, so in addition to muscle, helping your body create, with muscle mass, it also helps with fat burning, correct? It taps in, and I know you put me on a stack, and I started at one of the secretagogues. I've been sleeping so well through the night. I can't tell you, I haven't gotten sleep like this in a very long time. Can you also talk about the fat burning benefits and also the sleep benefits and libido also? It helps with libido. Can
Yeah,
you
I
touch
mean
on
that's what's great is because again, these things again, we don't want to think of peptides as symptom management. We don't want to be like, oh, I have this condition, what peptide should I take? I have this symptom, what peptide should I take? Those are the wrong questions that we're asking. These are modulating 100 different gene expressions. The growth hormone secretagogue modulates over 500 gene expressions. It's not just affecting one thing. So again, that's why when we're taking these different people, depending on what genes need to be expressed or modulated in you is going to affect you differently. So yes, I do have patients that I literally just put them on the Cimarelin and it does increase their libido. Or it does help with the fat burning because growth hormone helps decrease lipogenesis. Lipogenesis, all it means is the creation of new fat cells. Then lipolysis has to deal with the breakdown of fat. So your body actually uses fat as fuel with more growth hormone in the system.
that?
Now, if we want to amplify this even more, because even though you have the growth hormone in your body, the limiting factor is the amount of receptors that you have to activate that. So we can take another peptide to amplify that effect called BPC 157. So you guys have a combo of the BPC 157 and the TV 500, which is amazing because, again, we're hitting so many systems. These are considered super healing peptides. So BPC, the way that it works primarily is through angiogenesis, increasing blood flow. So we're increasing blood flow to the area of healing, and then it actually upregulates your growth hormone receptors. So now we amplified the production of growth hormone, amplified the receptor. So it's like, think of your body as like a parking lot and all those spots are full. If we add BPC, it's a new parking lot, and or it's like a sponge and we wring out that sponge and it can soak all that up. So now it just like amplifies it even more and you can just get faster and faster and faster results. So that's why I like pairing those ones together. That's pretty much like my standard stack with most patients. It's a growth hormone secretagogue plus the BPC and the TV500 because again, we talked about that chart. Disease starts with that inflammation. That chronic inflammation leads to tissue destruction. Then we have immune system dysregulation. In cancer cases or in neurological degenerative cases, it's the immune system that needs to be helped or upregulated or modulated. Because then after that, we start to lose our energy. Energy is in form of currency as ATP. ATP is produced from mitochondria. So if all these things are going off, your body doesn't have any resources to produce any extra energy to get anything done. And this is where people feel tired, brain fog, they're not sleeping, you're it just leads into more and more symptoms. So that's why we have to whole system approach. We can't just go for symptoms. So with the BPC, we deal with the chronic inflammation and the tissue destruction. And then with the TB, we balance that immune system regulation. And then with the growth hormone, we can start to increase that energy system because mitochondria are most dense within the muscle and not just any type of muscle. There's a difference between like high quality muscle and low quality muscle. So people who are losing muscle initially on the GLPs, it's probably shit muscle. It's probably low quality muscle that you're losing. So you have a low quality of mitochondria function. So then the nice thing is we can take those peptides and rebuild high quality dense muscle. So we're doing that at the same time while we're slowing down the lipogenesis and the lipolysis. Two things we also have to think about too in terms of fat burning. You have two different types of fat cells as well. You have white and you have brown. White is less metabolically active. Brown is more metabolically active. The cool thing about the body is the body can take white brown cells and convert them into brown fat cells.
Can you explain what metabolically active means so that everyone can
So
understand?
metabolically active means the rate of metabolism.
So
So if
you
something,
burn more calories, essentially.
yeah, so if something's metabolically active, it's burning at like a higher rate. So
Okay,
it's
so those are your
not energy.
two to goes. Oh, sorry, I'm sorry you didn't finish. But
No,
BPC and Samoralin, like
it's
those
more,
are a must-have in a stack.
those are a
Um,
must-have that I do in all my stacks.
okay.
Yeah.
I was talking to someone today and they said that it was a doctor. They prescribed BPC for cystic acne for the patients. That's incredible because it also helps with gut lining and I'm like, wow, I didn't think that.
It was a cystic acne case. I would probably put them on glutathione first, honestly, because that's known for clearing up the skin and helping push out a lot of those toxins through the liver. Because skin is just a reflection of the internal world that's going on inside of you, whether that's like your gut, your liver, your kidneys. The skin is considered like that third kidney. So it's
Mhm,
very much like one of your highest detox organs. So that's what they always say is anything that you put on your skin, if you can't eat it, don't put it on your skin because it
mhm.
goes directly into your bloodstream and your body has to detox that. So BBC is a good one, but if someone's looking to clean up their skin really fast, I would put them on glutathione, honestly, first, because
Okay.
that's gonna flush out that liver and that's gonna really clean up that complexion.
Okay, so let's talk about I want to spend some time on our product launch. So let's quickly talk about glutathione and NAD. Tell us a little bit more about the benefits of glutathione.
So, I mean, glutathione, it's considered your body's master antioxidant. It's actually produced by the liver. And most people are like, oh, like your liver can produce enough, it can keep up. No, it can't. We're bombarded by more chemicals than our body knows what to do with. So then our body starts to struggle in terms of what's called as phase one, phase two detoxification. Because what happens is something comes into your body, whether through breathing it in or eating or putting it on your skin, goes through your bloodstream, hits the liver. Liver has to decide what to do with it. It's like, oh, can I take this compound and do I need to store it somewhere in the body or can I excrete it? What it needs is it needs raw materials to be able to excrete it. So that's called phase one. Going from phase one to phase two, you're taking a fat soluble toxin and converting it into a water soluble toxin. Now, if your body doesn't have the sulfur bearing amino acids, which is basically what glutathione is made up of, then it stays in that phase one and it gets stored in your tissue. This is where patients get gout, arthritis, joint pain because your body is trying to store it the farthest away from your heart. That's why gout happens in the toe. Because if those toxins stay closer to the heart, you would poison yourself, you'd probably die. So that's where glutathione comes in because if we can give your body a high dose of glutathione to where it's like, hey, I can start to convert these fat soluble toxins, especially as you're on like a GLP and you're converting that, you're breaking down that fat, you're releasing those toxins into the bloodstream. It's going to be able to convert them into water soluble, and then you can excrete it through like breath or like through urine or feces and get that stuff out of your system.
Okay. So the must-haves to you are Samoralin, BPC. The nice-to-haves are glutathione and
Yes.
NAD.
Yeah.
Is that no?
Yeah, of course. Yeah. Again, glutathione is going to be more for like that detox, skin rejuvenation in the beginning. And then if someone needs a little bit of pick me up, because as we're bringing balance to your system, we're literally changing your gene expressions. If you do need a little bit more cognitive function, a little bit more energy in the beginning, this is where you can use NAD. And using NADIM is very different than taking like NMN or an MR precursor because what happens is you don't really get the benefits right away. If you take like an oral supplement, it's going to slowly build up over time because it's that precursor. But if you need like a jump like right now, taking the NAD IM injections, you're going to get that boost of NAD right into your system, and you're going to feel like an uplift in your energy. So people who need a little bit of an energy boost, a little bit of cognitive function, also in terms of like longevity properties as well too. NAD is also a great one to kind of like cycle in there as well too.
Anything else? That's a about should we touch on okay. No, let's give I would like to give the product of tonight a little bit of attention. So we are announcing the launch of drumroll GHKCU. And Dr. Wagner is going to tell us what is GHKCU, and the CU stands for copper. So I'm excited. So we're going to announce we're launching this in a week. We wanted to make sure everyone gets enough training ahead of time. Dr. Wagner, tell us why you chose GHKCU as the best peptide for us to continue on our journey. And
Oh, I chose it.
well, you recommended it. You were the one pushing for it.
Yeah,
So tell us.
yeah,
Here's
yeah.
the GHKCU.
GHKCU, super versatile peptide. Most people know it for its skin rejuvenation and collagen modification properties in terms of like skin and hair, but it goes much deeper than that. So GHKCU was actually discovered back in 1973 by I think it was Dr. Laurel, and he actually discovered it in your plasma. So your blood is made up of multiple things. So it's like red blood cells, white blood cells, and a small portion of it is plasma. So you have 200 nanograms of GHK in your plasma during like the age of 20. And then as you age, like once you hit 60, that drops down to about 80 nanograms per milliliter. So it significantly drops down. And this is highly, highly linked to longevity as well, too. GHK is also interesting too because of the affinity it has for copper and the size of it. This is one that can actually be applied topically as well as an injectable. So if you take it more in the injectable form, you're going to see more of the longevity benefits, such as like wound healing, immune system modulation. It's super high in antioxidants, anti-inflammatory. It improves stem cell production, and it's like actually antiviral as well too. You still will see a lot of the skin benefits from doing it or from doing the injection, such as like stimulating hair growth, tightening loose skin, improving skin elasticity. But more of those people actually like use it topically a lot of times. And it absorbs pretty well into the skin, which is really cool about these things because honestly, most of the peptides only work through the injectable form because I know people will sell like the BPC capsules, but I just really haven't seen even the benefits of doing like BPC capsules or the GLP tablets or capsules or drops. Those ones just like don't work, but the GHKCU, it works topically and injectable, and it hits again so many systems through in the body. So it's not just like an aesthetic peptide. It's a longevity peptide. And one that I like to really, you can pair it with so many different peptides. I mean, you can easily pair it with the Semarelin just by itself, or you could do the BPC TB500 and the GHKCU. I know some people have kind of coined that one as like the Wolverine Stack 2.0 because again, it just like amplifies that healing and wound response. So again, this is a super, super versatile peptide that you can really add in there at like any point. And it's great because especially people as on their weight loss journey, one of the things as you're losing weight, you might need to kind of like tighten up that skin a little bit. So I've actually used a combo of the GHKCU and then also a supplement called Gotu Cola. You take those two together, you can actually get a lot in terms of skin reduction. And that's something that Charles Poliquin, he actually figured that out. So he was a trainer and he would work with patients who would lose a lot of weight and then they would have all this loose skin. you would put them on 600 milligrams of gotu kola. I think it was like 3 times a day. It takes about 6 months to saturate it, but if you do that in combination with the GHK, cuts it down to about like 3 or 4 months, and you can get like some pretty amazing transformations in terms of like skin health.
Okay, go to cola, not to be confused with Coca-Cola. All
Yeah.
right, let's talk about let's talk about as I've been doing my research around this peptide. It's fascinating. It can do so much, but one of the benefits is hair growth and hair follicle stimulation. Can you touch on that, how it helps with the anagen phase and helps improve the follicle cell proliferation and all that great stuff?
Yeah.
Because
So,
there's a
so,
lot of us that could really
so
use fuller hair.
what's happening specifically in the follicles is there's an amount of inflammation that's going on, and the follicles can't regenerate themselves. So again, what it's specifically doing is it's helping with that inflammatory response. It's improving stem cell production, which there's stem cells actually in those follicles itself. So if you can't neutralize the inflammation and help the production of the stem cells within the follicles, that's where you can't get that hair growth back. So it hits both of those at the same time. That's why, again, you can do it either topically or you can do it either injectable, and it's going to help with that whole production. That's really like the mechanism that it's working on right there.
Someone just wrote a comment about NAD, GHKCU versus NAD for hair growth. What are your thoughts on
I hate these this or that questions, honestly. They're,
both?
they're both
Uh,
they're both gonna work because again, these things are working on full systems. For me, for each person, it's hard to say exactly what 100% you're gonna be deficient in. And it could be you need a combination of both. Maybe you need to fill up your bottle of NAD so your body has the energy. Then you go to the GHKCU, your body has that NAD. Now it's producing the extra stem cells and getting the inflammation down. It can do it. That's why you have to combine these things together. And there's really no right or wrong answer. But in terms of if we're looking at primary, secondary, and tertiary actions, GHKCU is going to be better. The NAD is working, its primary, secondary, and tertiary modes of action are very different and they're not as focused on like the hair. So, again, because the affinity for hair regrowth is higher with the GHK, but again, not to say that the NAD wouldn't improve it.
okay, so collagen has gotten so much hype nowadays. Collagen shakes and collagen drinks and collagen. You see it everywhere. Can you tell us the difference between collagen supplementation versus taking GHKCU for collagen production? Can
Mm,
you differentiate the two and maybe talk to us a little about that?
Yeah, again, it's similar to taking like NAD versus taking like an NAD precursor. You're giving your body, if you're taking collagen peptides orally, like in your coffee or in your shake or whatever, hydrogen collagen peptides, you're giving yourself the building blocks to help repair your skin on a daily basis. But what we're doing specifically with the peptides is again, it's cellular modulation as well as cellular efficiency. So we're affecting the cell directly and we're affecting the matrix of collagen. We're affecting how your body produces that collagen. So not only does it have the building blocks from, let's say, taking collagen orally, but we're affecting how that DNA goes through transcription by taking that GHKCU copper peptide. So it's just again, it's more of an amplified effect. I'm a fan of taking both for sure.
Awesome. And you touched on it. Can you talk to us a little about its antioxidant and cell protective properties? I know the research suggests that it has antioxidant properties that help neutralize free radicals and protect the cell from oxidative damage. Can you touch a little bit more on that and how?
Yes. So like in my own experience with the antioxidant and free radical properties that it neutralizes those oxidative stress and free radicals is one easy way that you can see that is in the summertime, if you go to the beach and you get a sunburn and you take that GHKCU, it literally will wipe that sunburn away the next day. That's every time that I've done that because what happening on the skin, we're seeing a visual representation of that oxidative stress because the skin can't adapt to that. It can't produce enough melanin based upon the amount of UV rays that are hitting it. So that's why your body goes red because it can't do that enough. You put that GHK copper on it, it neutralizes a lot of those free radicals, helps with that anti-inflammatory. It's actually like pretty soothing too when you put it on. And then it almost just like wipes it away. It's like pretty crazy.
Um, can you talk to us a little about stacking? So now that we have these peptides, right? They're like little building blocks that we're adding on to one another. I know you do yours morning and nighttime, you stack them. Um, can you talk a little about stacking, what it is, why, I mean, we're slowly building up to that. We and just touch on the stacking element for everyone.
So the biggest thing with stacking is we're trying to take a small handful of peptides to be able to modulate more gene expressions that complement each other to get people to their goals faster. So instead of using a spoon to dig a hole, I can use a backhoe to dig something faster. So it gives me a bigger tool to dig with when I quote unquote stack or add these things together. It gives my body more horsepower to get those results. So I mean, you can still dig a pool with a spoon. It's just going to take you a lot longer. So that's why I prefer to stack because again, we're able to get those results a lot faster. And we want to work on different systems. There's multiple systems within the body that we want to approach. We want to, make sure we're dealing with chronic inflammation. We want to make sure we're supporting the immune system. We want to make sure that we're supporting energy systems. We want to make sure we're supporting longevity. So think of yourself as like a star, a 5-point star. We don't want to always just be working on this corner over here. We want to work on this corner a little bit here. Then we can use another stack that's going to work on this corner. But by balancing that out here, when we go back over here, we can go even farther. Otherwise, as you go through your health journey, you're going to plateau. And we want to keep you from plateauing. So that's where we can create these stacks that are amplifying and complementing each other to hit the whole spectrum of your entire health. So we're not only, focusing on weight loss or hormone improvement, but we're taking you from weight loss to wellness to anti-aging. So we're helping you evolve along your journey instead of just like staying in one season. When a show's on, if it repeats the same plot over and over again and you wake up going through the same thing, eventually like that character development gets boring. If we can take you from where you are here to maintenance to anti-aging, we're developing your character and you're going along your journey in a whole new way. And so that's where the stacking is super, super important because we're able to hit so many different systems very effectively.
Okay, so the protocol for the GHKCU is 2 mg, 20 units, 3 times a week for 8 weeks. How many times would you have to cycle this? The 3 times a week for 8 weeks. How many cycles of 8 weeks would you need to do in order to see the benefits and results? Do you see it right away? Does it take a cycle or two? And how long should you stay on this? What is your recommendation?
Again, that's very, very patient specific depending on how much damage is going on in the body and where each person is at. But I will say, even if you don't see the results externally, you feel the results internally. Like I had a young patient too. He was only, man, 24. I put him on BPC, TB, and GHKCU. He took it day one. He's like, oh my God, like I feel like I lost 5 pounds of inflammation within a day. And like that's from like a young, quote unquote, healthy person. So is he going to see the skin rejuvenation and all these other things within that day one? Probably not. But you're going to feel internally the difference right away. Again, I had another patient totally different spectrum in his 60s. He's had brain surgeries. He likes to be active and do golf, but his hips always hurt him. Put him on BPC, TB, and GHK. Called me on day 5, and he's like, "Hey, I haven't woke up with any hip pain in the last 4 days." Is he going to see again that skin tightness and rejuvenation? Probably not within the first 5 days, but again, he's feeling different. And he also commented, like, I think my brain's working better. I think I can think clearer because a lot of times, a lot of us are living in like a haze of this chronic neural inflammation that's going on within our body. And we just like, we set that as our new normal. We're like, oh, this is just how life is. This is just getting old. This is just, this is just it. But that's not it at all. And so that's what's really powerful about these things is people can feel like an immediate effect within those first weeks. To get the other effects, that's where it's going to take again a little bit more time, but you do start to see like that glow, that tightness, that firmness pretty quick with pretty quick, especially if you're stacking them.
Well, that's one of the reasons you put me on the stack. I had mentioned to you that I had lost weight on GLP-1s and I wanted to tighten and firm the skin. So you were like, yes, we got to put you on the secretagogues and then combine it with GHKCU. And guys, I see the skin glow. I don't know if you can tell, but I'm I'm glowing. So yeah, and the neural inflammation, I think that's a big one too. You had mentioned that for brain health.
Again, that leads into so many people don't really realize like what that can bleed into. It not only does it bleed into cloudy thoughts, but it affects your mood.
Mhm.
It can lead to other things such as like depression, low activity, just like feeling overall cranky. And again, when people don't feel well, when people don't feel like they're empowered to really take their health back or really like change the needle to increase that vitality and that quality of life, you get kind of hopeless. And what's really hopeful about these peptides and just the regenerative medicine space in and of itself, which again, I can say a lot of great things about it. I can say a lot of terrible things about it because in the regenerative medicine space, everything promises to cure everything. Like every supplement, every this, every that. It's like take this, take that. You'll be able to do whatever. And I'm like, okay, that's not quite how it works. But when you do have a basic understanding of how these energy systems work, and you can put these things together in a comprehensive way, and we can really start to use like the intelligence of the body in our favor. The biggest thing of what I like about this is you're really empowering people again to take back their health, and this is how you change culture. This is how you change lives. Like you change one person's life at a time, and it's like they feel better, so they want other people to feel better around them. So they're like, oh, I'm gonna say something nice to this person, or I feel good, so I want that person to feel, and it just like it's a ripple effect. So it bleeds into so many things. So by you taking responsibility for your own health, and you filling up your own cup and feeling better, you can take care of other people more efficiently as well too. And this is like real change beyond just like helping people with their symptoms. Like again, we're changing lives and culture with this.
Love that. That's why we have these community calls. It's just about educating ourselves, becoming an advocate for ourselves first and foremost, and then our communities. It's like put the oxygen mask on yourself first and foremost. I want to take some of the questions that came in. This last one it says, is there a recommended cycling on and off any slash all of these? Are the GLPs the only ones recommended to take consistently and stack the rest on cycling, or others to take consistently too? So I think people are wondering about the cycling of some of these peptides. Can you take them consistently? Which ones are the ones that you could take consistently? Maybe you could elaborate on some of these questions.
Yeah, in terms of most of them, 8 to 12 weeks is really like where you want to be on them for, and then you want to take about like an 8 week period off for most of them. Even the GLPs, even though you can be like quote unquote on them for a long time, I don't like to be on like the the higher spectrum of that linear line of the dosage. If you're going to be on it longer, eventually we need to start to titrate you down to like that lower linear line of like that microdose, if that's something that your body still needs. But for the most part, 8 to 12 weeks on, 8 weeks off. Because again, we want to work on multiple systems within the body. We don't want to get stuck within one thing. We want your body to be well balanced. And also we want you to learn like what your body really needs and what you really respond to the best.
Um, let's see. A lot of people are asking about topical. We are coming out with the injection form, not the topical, just so you are aware, but that could be coming in the very near future. Um, so if you guys have any questions, please let us know in the comments. I read the copper in the injection burns like crazy. I've been injecting it in the in my in the rear area. And I haven't noticed. I mean, there's a slight bit of stinging, but I find that to be
Can,
common.
it can, it can, it
It
can.
can. Yeah. Well, I was talking to our pharmacy owner today, and he was saying, because somebody else brought that up, we've been having a lot of meetings, and he was saying we filter ours 3 times at TXPM. They filter their GHKCU 3 times. So he goes, it should be very rare that you experience the stinging and the burning sensation, but I wonder if,
And again, it can happen, and it typically lasts only. I haven't had like the burning myself, but it can be a little bit uncomfortable for about 20 to 30 minutes sometimes. And again, that's rare cases. I will say though, another thing about the GHKCU is it does help with patients, especially who are very like Th2 dominant. And what that means is you are high histamine responder. So if you have like a high histamine response, it does help those people with overactive histamine reactions.
okay. So if you're looking for hair growth, if you're looking for firm skin, better skin, that skin glow. So I would call this the aesthetic stack, combining glutathione with GHKCU. Am I right or wrong on that? If you're
Yeah.
looking for all the aesthetic benefits.
Then if you want a healing stack, you just combine it with the BPC and the TB500. So then it's a wound healing stack. And then you can also combine it with the growth hormone secretagogues because technically the Summerellin does help with collagen production as well too. So
That's awesome. Well, thank you so much, Dr. Wagner, for being on and educating our community once again. We really, really appreciate your time, and we appreciate your time, you guys who joined us tonight for tonight's call. Thank you so much for being here, being part of this community. Thank you, thank you, thank you to everyone. We'll see you back very soon, and we'll give you all the announcements about the launch around GHKCU. Thank you all so, so much. Thank you, Dr. Wagner.
thank you, honey.
Have a good night.